All attendees are in listen-only mode.
Hi everyone, this is Rosemary joining us from Baltimore. Welcome everyone to the Qualitative Data Analysis webinar. I'm just going to wait a few more minutes to allow others to join, so we'll just get started in a few minutes if that's okay. Right, welcome everyone, and welcome to those who have just joined us. This is Rosemary Morgan joining you today from Johns Hopkins Bloomberg School of Public Health here in Baltimore. It's about 8 a.m. here, very, very sunny, nice day. I know that you're all joining us from different time zones, and I want to give you a very big warm welcome today. I'm sure a few more other people will join us in over the next 5 or 10 minutes, but we'll get started today. So today we're going to be talking about qualitative data analysis. I know that all of you are in different stages of your projects. Many of you are currently collecting data and will be moving into analyzing this data if you haven't already started. So this is a really great opportunity to share any issues that you're having today, to ask any questions, to just discuss anything related to qualitative data analysis that you're interested in. So today we're going to just do kind of a brief introduction to qualitative data analysis, think about some of the principles, aims, and approaches that you can use, then move on to talking about the specific stages of analysis, then look at one approach in particular, framework approach, just to highlight as an example, and then end with a conclusion. So we only have an hour and a half today. We're going to be covering a lot in various levels of detail. Unfortunately, we can't go into too much detail with anything over an hour and a half. But if you want any more, want any more information on anything we talk about today, do get in touch after or ask questions. So just to kind of do a little bit of housekeeping before we start, there are various ways to ask questions during the webinar. So after each section, there will be an opportunity to ask questions. You can raise your virtual hand to ask a question during each discussion section, and you should see this hand on the right-hand sidebar. It's a picture just of a little hand. You just click on that, and that will tell me that you'd like to ask a question. And you can also use the sidebar to write questions anytime during the webinar, and these will a notification will pop up and let me know that there's a question. What I'm going to do now is I'm going to unmute everybody's microphone and then leave it up to you to mute and unmute yourself. So I'm going to go ahead and unmute everyone now. And if you can see, we can hear some background noise. So it means your microphones are on. So what you need to do is find the little green microphone button, or it should be gray, it should be green, and then click on that and it'll turn gray, and that means you're muted. So that's great. Everyone now is muted. So what we'd like to do now is just have some brief kind of introductions, go around and have everybody introduce themselves, say their name, say their country, team, the title of the project, and then share one thing about qualitative data analysis that you'd like to learn more about and or are struggling with. I just also want to take a moment to highlight that there's a brief 5-minute evaluation at the end of the webinar, and be really grateful if you could all take the time to fill that in. So I'll start by introducing myself. I'm Rosemary Morgan. I'm a research fellow here at Johns Hopkins Bloomberg School of Public Health. I have a strong background in qualitative data collection and analysis, particularly using the framework approach. And the one thing I've kind of struggled with qualitative data analysis, and I still don't have all the answers because it's a work in progress, but is getting to that real kind of interpretive stage of analysis. It's easy to get to the descriptive stage, explain what is in your data, but then to go that extra step to look for patterns and relationships and to interpret your data, I've struggled with, and I hope today that I can provide some tips and strategies to help you to get to that stage. So what I'm gonna do is go down the list one at a time. And if you're just joining us now, what we're doing is everyone is gonna introduce themselves, and I'm gonna go down the list one at a time. So we'll start with Adam Bircher. So if you can please unmute yourself and introduce yourself to the group, that would be great.
Hello, hi, my name is Adam. I'm from South Africa, and I'm part of HST, Health Systems Trust. Our project is called a case study on the role of general practitioner contracting in strengthening health systems towards universal health coverage in South Africa. And I'm also a student doing a Master in Public Health at University of Cape Town, and I'm specializing in health systems. So I'm more qualitative orientated in my training. And what I find that I struggle with is a little bit of the opposite, where I actually tend to see patterns where there actually maybe aren't. So I very much like to interpret things and find relationships between things, but what I struggle with then is building that evidence every step of the way to prove and to show that the interpretation is credible or valid. So that's me.
Great, thanks very much, Adam. That was great, and hopefully today, especially with the use and overview of the framework approach, we might be able to you might be able to see different ways that you can start to build that evidence to explain your interpretations, and that sounds like a really nice problem to have, though. So if moving on, and if you can just please unmute or mute your microphone after you finish speaking. We'd have, if you're just joining us, we've had a few more people join us. We're just going down the list and having everyone introduce themselves with their name, country, team, title of project, and then sharing one thing about qualitative data analysis that they like to learn more about or are struggling with. And I'm just going in order. And the next person on the list is James Burnett. So I'm just going to unmute your microphone here. And James, if you can introduce yourself to the group, that would be great.
Good afternoon, everyone. My name is James Michael, although I normally just go by Michael. I'm a researcher at Health Systems Trust, and I work on the GP Contracting Initiative project. And my aim here is just to learn more about qualitative research analysis. My strength is in quantitative, so it's just for me to learn more to use going forward. Thank you.
Great, thanks very much. And if you, so you joined us a little bit late, we've unmuted everybody's microphone, so it'll be up to you to mute yourself and unmute yourself at the appropriate time. So if you can just find the green microphone button and mute your microphone, that would be great. Thank you. So moving down, the next person on the list is Linda. Linda, if you can please unmute your microphone and introduce yourself to the group.
Hi, afternoon everybody. My name is Linda Murafi. I'm a senior researcher working at the Health Systems Trust. I work with Adam and Michael and everybody else on the GP contracting study. So a little bit about myself. I also come from a bit of a positivist realm, but I've been doing a lot of health policy and systems research over the last few years, and I've really begun to enjoy it. And I think my sort of one thing that I would like to sort of learn about or sort of gain confidence in is similar to what you spoke about, Rosemary, about once you get past that initial descriptive phase, just learning to be a bit more reflective and allow that sort of interpretive, to get to that interpretive stage of the qualitative data analysis. So I think that's my hope for the session. Thank you.
Great, thanks very much. And again, I hope that we are able to give some suggestions on how we can do that today. And the next person on the list is Renee English. So I've just unmuted your microphone. So Renee, if you can please introduce yourself to the group.
Hi, I'm Renee English. I'm also from the Health Systems Trust. I work with the team that's just introduced themselves. And as Linda was just presented before, my background is very similar, and any mechanism for me, how data is synthesized, how to approach the data, and my experience in using mixed methods approaches and qualitative approaches is really what I've absorbed from working with people who work in that field and other projects over time. So also being able to employ these approaches using some kind of more robust framework and some kind of stronger theoretical background, I think would be very useful for me. So I'm very excited about this webinar. Thank you.
Great, thank you very much, Renee. And if you can please just mute your microphone, you'll see a little green button that you need to press, microphone button. Thank you. Moving on, the next person on the list we have is Severin Rakic. If you can please introduce yourself.
Hello everybody. Good to hear some of you that we haven't a chance to speak for a long time. My name is Severin. I'm from Bosnia. Our research is related to introduction of safety and quality standards among private healthcare providers. We have recently gone through analysis of big amount of data collected through interviews, and where we struggled and where we thought that we haven't used possibilities well is use of different programs to prepare visualization of qualitative data. So that's one of the areas that I'm interested in.
Great, thank you very much. And moving on to Sinisa. I've just muted your microphone, so please go ahead and introduce yourself.
Yes, hello everybody. I'm Sinisa. I'm also from Bosnia. I'm working with the team on the research that Severin has just mentioned. It is about introduction of safety and quality standards among private providers. I'm also involved in the work of accreditation and quality agency here in Bosnia, And we need really a good knowledge about qualitative data research and interpretation in our daily work, and as well as for the need of this research. So I'm really looking forward to this webinar, and looking forward to learn something new. That's it, basically.
Great, thanks very much. And if you can please go ahead and mute your microphone, you'll see a little green button that you need to press. Great. So the next person on the list is Thailanu. If you can please go ahead and unmute your microphone and introduce yourself. Hi, Thailanu. I see that you've unmuted your microphone and we can hear some background noise, but we can't hear you. Okay, there might be problems with your microphone there, so hopefully maybe if you can get that sorted out. You feel free to introduce yourself in the chat box as well, and you can send that to the entire group. We also have Zubin Shroff joining us today on the call. Unfortunately, I am unable to, oh, maybe I can mute you now, unmute you now. There we go. If you can please, Zubin, if you want to go ahead and introduce yourself to the group, that would be great.
Can you hear me?
Yes, yes, we can. Thank you.
Okay, all right, fine. So thank you very much. I'm Zubin Shroff. I'm the coordinator for this project from the Alliance for Health Policy and Systems Research. Many of us have met at the workshop in Tunis, and my own interest in this is in qualitative data analysis. My background is in using mixed methods, qualitative and qualitative, for political economy analysis, and my own interest is trying to understand issues around triangulation, content validity, and these are the kinds of issues in qualitative research, the kinds of issues that quantitative researchers often like to give a hard time over to qualitative researchers about.
Great, thanks very much, Zubin. If you can, I'm not sure if you're joining us on the phone today, so I'll go ahead and I'll mute your microphone, but at any time that you want to join, if you can just raise your hand or send a message, that would be great if you want to join the conversation. Oh yeah, no, you've muted yourself, that's great. Great, so yeah, using mixed methods, I mean, you talked about this today and so did Renee. It's not something we're going to be going into in any detail today, but hopefully there'll be a future webinar that we can look at mixed methods in particular. Also, due to the time restraints today, we're not really going to look at validity and reliability per se in any detail. It will be kind of built into some of the discussions. But if this is something you want to raise during the question and answer period, we can definitely talk about that in more detail. I'd just like to now give Lygia a chance to introduce herself. So please, Lygia, go ahead and unmute your microphone.
Thanks, Rosemary. Can you hear me okay?
Yes, we can. Thank you.
Hi, my name is Lygia, and I'm one of the members of the Technical Support Center at Hopkins. And I think I've met most of you in person because I work with South Africa, the Bosnia, and the Burkina Faso team, but it's a pleasure to meet virtually at least some of the new colleagues in the South Africa team. And it's exciting to have you all here, and I share very similar struggles. I think we're all in the same boat when it comes to quality data analysis. So hopefully the webinar will give you some tools to manage these normal challenges a little bit better.
Great, thank you, Lygia. And we also have Krishna joining us today. So Krishna, if you can go ahead and unmute your microphone and introduce yourself to the group.
Hello, can you hear me?
Yes, we can hear you, thank you.
Okay. Hello everyone. I guess many of you would know me from our meeting earlier on in Tunis and also from the subsequent emailing we've been doing. For those of you who don't, I'm Krishna Rao. I'm leading the Technical Support Center from the Hopkins side, and it's been a pleasure working with Lygia, Sarah, Rosemary and Zubin. I'm not much of a qualitative researcher myself, but I've used qualitative methods and I'm always eager to know more about it, which is one of the reasons why I'm on this webinar. So looking forward to listening to what Rosemary has to say. Also, she mentioned that we might do a webinar on mixed methods. That's certainly on the agenda, and I think it would be done in the next couple of months for sure. So stay tuned for that. Okay, over to you, Rosemary.
Great, thank you very much, Krishna, and welcome everyone. I just want to go back to Thailanu one more time just to see if you've had an opportunity to have your, and Krishna, if you could just unmute your microphone, that'd be great, thanks. Do you want to try one more time and introduce yourself?
Me?
Yes, there, it seems to be working now. Please go ahead and introduce yourself.
Okay. I'm Krishna Rao. I'm
no,
leading the...
Oh, sorry, Krishna. No, that I was going over to Thailanu to see if their microphone was working now. We heard your introduction. Thanks. Yeah, no, that's great. If you just go ahead and unmute yourself, or mute yourself, Krishna, that'd be great. And we'll and Thailanu, I'm not sure if your microphone is working now. If you want to give one more opportunity to speak. No, it doesn't seem to be working. That's okay. If you have any questions, Thailanu, please do type them in the question box, and they'll pop up and I can read them to the group at any time. So yeah, if you do have any questions, please type them in. So we'll go ahead and get started on the webinar today. We'll start it with the introduction to qualitative data analysis, thinking about principles, aims, and approaches. So there are some key principles to qualitative data analysis. These include the fact that the explanation of data, so your findings and your interpretation of those findings, emerges from careful and meticulous reading of the data. It involves a process of interpretation where the researcher produces meaning out of raw data, and this raw data can take multiple forms, such as interview data, as you know, focus group discussions, observations, and document review. And then the analysis of the data and your conclusions need to be firmly rooted in the data itself. And this is what Adam was talking about when he was introducing himself, the need for providing kind of evidence to back up your interpretations. This is what this means, that all of our findings and interpretations in relation to qualitative data analysis need to be firmly rooted in the data. So the process of analysis itself is very iterative, and what that means is that it goes back and forth. It's more of a cycle. It's not a linear process. So the development of theory, hypotheses, or concepts it's based on a process that moves back and forth, comparing empirical data with codes, categories, and concepts being used. So you're constantly, looking at the data, coming up with interpretations, going back to the raw data, trying to explain things. It's very much a back and forth process. So it's important not to think of it in a linear way. And thirdly, the analysis of the data involves also reflecting on researchers' own preconceptions, whether these may be personal prejudices or biases or just our own worldviews and understanding of the world. And this is really about the importance of reflexivity. It's thinking about how do us as individuals, as health systems researchers, health policy researchers, how does our own understanding and worldview affect the way that we interpret the data? And this is a really important point in relation to qualitative data analysis. So really then, the analysis of qualitative data is based on the logic of discovering things from the data, generating theories on the basis of what the data contains, and moving from the particular features of the data itself towards more generalized conclusions or theories. So there are a few potential aims of qualitative data analysis. Not all qualitative data or projects will look to have these as kind of your final aims and objectives, but some of these might be more applicable to you than others. For example, one potential aim might be to develop a conceptual definition, for example, for survey design. This, a few of you had talked about the use of mixed methods. This is one way that qualitative data analysis is used in conjunction with quantitative surveys. Is you might want to, before you design a survey and implement that in a community, you might want to go into that community to find out what they think about a certain topic. What are their understandings? How do they define something? So that the words and the terminology, the language that you use in the survey is really based on their own local understandings. And I've just included some papers here that are examples of these different aims. If it's something, if you want to find out more about one or more of these, you can look into them. So the next one then is developing typologies and classifications. The example here is thinking about kind of local fever illness classifications, implications for home management of malaria strategies. So a lot of qualitative research is used to develop typologies, and what this means is thinking about, you know, with your range of respondents, for example, all the different, if you're looking at strategies for fever, for example, what you might want to do is look at all the different ways and types of strategies that your respondents used and develop a typology about that. Or a classification system. The next point here, the next potential aim of qualitative data analysis is thinking about how we explore associations between attitudes, behaviors, and experiences. So really it's thinking about and how these might relate, like do people's attitudes and beliefs, for example, do they match what they're actually doing? What do people think about a certain topic? Why people use something or not use something. The example here we've given is why some people want latrines in rural benign and why some may not. So what you would do is you'd go in and you would explore people's attitudes and thoughts and around this issue, and then maybe also look at what they're actually doing and what their experiences are. So another potential aim is developing just general explanations for phenomena. And this, I think, almost all qualitative research does to various degrees. It's looking at thinking about why something occurs. And to me, this is the real kind of value of qualitative research in comparison to quantitative research. It really allows us to really get into a certain topic and look for explanations for why. Why do people act a certain way? Why do health inequities exist? You know, why aren't people accessing a health service? Why are health workers absent from work? Really, and this is something that quantitative research sometimes isn't really able to get at, those really meaty explanations. And then also, qualitative research allows us to generate new ideas and theories over things that maybe never existed before. So there are many other aims of qualitative data analysis, but these are just kind of 5 key aims that you may want to look at and use within your research. And Linda's just asked if you'll be able to share the slides after the webinar. Most certainly I will be sharing them with everybody. And then you'll be able to access all of these different resources. So moving on, there are various approaches to qualitative data analysis that you can use. Pretty much all qualitative analysis, however, involves a type of thematic analysis. And what that means is that you identify and assign themes to passages of text, which is known as coding, and we'll go more into that in a moment. In the past, this was often done using scissors and glue, scissors envelopes, cut it, but now it's more, we use more computer software to do this, but not always. I think it depends on the size of your data, your data and how many interviews and or focus group discussions that you've collected, for example. So now you might cut and paste in word processing software or use a different analysis software like NVivo or Atlas. So approaches to qualitative analysis use different degrees of deduction and induction. What the key difference is whether or not you allow the theory to emerge from the data, or you come with a pre-existing theory or ideas. And I would say that most research and what most of you will be doing will be a combination of both of these. So deduction is applying a theory or a framework to analyze the data. It might be, you looking at the literature, seeing what other people have said about the topic, developing a framework, or thinking about what some of the key issues and themes are, and using that to help design and develop your qualitative data collection tools, for example, your aims, objectives, and questions, whereas induction is when the theory is grounded in the data. If you're doing a purely inductive study, you would try to avoid doing any background reading and looking for existing knowledge on a topic. You want that to emerge from your data. But like I said, most of you will be doing a combination of both of these. You'll be coming in with some pre-existing ideas, but also allow those ideas and theories to emerge from the data at the same time. So there are various approaches, as I mentioned before. I've listed a few of them here. I'm not going to go into any specific detail about them today, just to highlight that there are various approaches. Most of them, what you'd want to do, what's important to do, is to decide on approach prior to data collection, as it will really inform your data collection activities and the development of your data collection materials. Some of these, for example, you'd use them depending on what your overall aims and objectives are. Discourse analysis, narrative analysis, conversation analysis, for example. Really, they're quite similar in the sense that they look at human language, they look at how people construct words, they look at how people develop stories to explain situations and their experiences. And I would say these approaches you'd really only choose if your overall aims and objectives warranted you to look at those specific aspects of your data. So what I would recommend is if you're interested in these different approaches, is to go away and read more about them, because I can't really do any justice today to go into any specifics. What the two that I'll highlight today is what usually most of you will probably be doing, which was content analysis and framework analysis. So as I mentioned, these are all types of thematic analysis. Content analysis is really what most qualitative researchers do, looking for themes and patterns and relationships, for example, and how often and how much certain things are discussed within your data. And framework analysis, and we'll go into more of that at the latter part of the webinar today, is really just, the difference is it offers a series of steps to help you manage your data and analyze your data. So like I said, if you're interested in any of these, do go and read more about them. They're all types of thematic analysis. They're all the type of qualitative analysis. The main take-home message is that you really need to decide on the approach that you're using from as early as possible. And then I would also recommend that you only choose one type of approach to analyze your data. Some research might warrant two approaches depending on types of data, but try not to make things difficult or challenging for yourself, and just choose one approach when you're moving forward. So I'd just like to stop now to see if there are any questions or comments about anything that we've just talked about. I've got some questions here for discussion. And if you do have anything that you'd like to share, feel free to raise your virtual hand. So the questions for discussion are thinking about maybe in your past experience, is there anything specific that you were looking at to explore with your qualitative research, or what have you used qualitative data analysis for in the past? So I don't see any kind of virtual hands raising. I mean, we've got teams today. We've got quite a strong team from, South Africa, and we've got some representatives from Bosnia as well. I'm wondering if anyone from the South African team, especially particularly those that have done qualitative research in the past, if you want to talk about, what you've used the research to look for. Have you developed typologies? Has it mainly been to look for relationships and overarching explanations, for example? So Adam, yes, please go ahead.
Hi. Yes, I used qualitative analysis for my current thesis, and my research question is how does the alcohol industry try and influence the policy formulation process in South Africa, or how does the alcohol industry influence a specific policy that wants to ban alcohol advertising? So it was inductive and deductive because I had to do a lot of background reading and find kind of frameworks that are already in place that would essentially help me order my thinking and order give me a conceptual lens with which to see this kind of chaotic data that's in front of us. So what I saw what I used was number one, the policy formulation process and how policies are made, kind of conceptually, and then number two was political strategies in general, kind of very loose political strategies. There were four kind of categories. That lens, I kind of collected my data, and then I used that, and then looking at the data, I kind of had to forget about these lenses and then just look and see what kind of came up and what presented itself. And then I had to kind of look for patterns and themes and everything that was going on. And eventually, as I kind of learned about what was happening from people's perspectives, I did a whole bunch of interviews and a literature review, a document analysis. I had to superimpose that framework back onto my data. So it's always a give and take with the inductive deductive approach, and I think that essentially, I mean, we can never go into a qualitative research having being completely neutral, because we always have something that we are, we have a bit of a, what's the word, a perspective on things. We have a way of looking at the world. But at the same time, we have to do our best, to of course be reflective and see what comes up. So basically, the end result were themes that that was already given to me from the framework, and I think that was actually the hardest part of my research, was actually trying to order the chaotic data into a very ordered, rigid framework that was given from previous research. So I'm not sure if I've answered your question, but that's a bit of my perspective from my research.
Oh no, that's great, Adam. Thanks very much. That is a very good example of thinking about, you know, the process of qualitative data analysis, and you know how it involves that both is both inductive and deductive at the same time, and how it's so iterative and going back and forth, and it really is making sense of this huge amount of very chaotic data, and it can be very overwhelming at the beginning as well. And that's why one of the reasons that framework analysis has really appealed to me, we'll go into that in a moment, is because it offered a series of stages and steps that I could take to help manage it. Other people may not like to use that particular approach, but that's one way I found to help me manage and organize my data. And I think the point you made about how we can never be 100% neutral is a very good point. And that's a point we made at the beginning about reflexivity, thinking about how our own perspectives and worldviews influence how we analyze the data is very important. Now, there's that one approach at the top of that list, grounded theory. That approach really tries to be 100% inductive, which is extremely difficult to do. And you often find that approach in anthropology mostly. But as I said, most of us, I think all of us, it'll be a combination of both, because purely inductive research grounded theory takes a long time, you know, years, 2 years for different projects, and a lot of us don't have that amount of time. So we are using a combination of both. And again, it is, you know, highlighting themes, looking for patterns, trying to explain what is in your data. Great. So I think that was a really excellent example of what qualitative data analysis has been used for in the past. So moving on now to kind of the stages of analysis. There are various stages. It is a circular motion here, as you see. As I mentioned before, it's a very iterative process that we go back and forth. So while this is presented as kind of a cycle of beginning and end stage, when you're in the middle, you're going back and forth and up and down and right and left. So just keep that in mind, and there's kind of no wrong way, in a sense, to do that. So most of us will start from the same point, however, which is, you know, when we're designing our qualitative research studies, we're thinking about the approaches we're going to use for analysis. This will influence often our data collection activities. So once you've done that, we go and we actually do the data collection. And this is thinking, and analysis really begins at this stage. You know, it's not, we don't start the analysis after we've collected all our data. It starts while we're collecting the data. We're taking notes, we're reflecting on what the data says. We move on to transcription and translation. I should say we'll go into each of these in turn, so I'll just list them here. The next stage is familiarization with the data, then organizing and indexing the data, developing a coding frame, rearranging data by codes, interpreting the data, and then representing or writing up the data. So during data collection, notes and reflections, I mentioned that this is really where data collection begins, our data analysis begins. I mean, we've already decided on our approach, for example, so this is where really kind of our ideas, some of our, what we think is emerging, we're writing that down. So it's very important to take field notes during and immediately after data collection. The level of the detail will depend on the purpose of research, also whether or not you're recording. If you're recording your data, your interviews or focus groups, you may want to take notes on different things, you know, how people are interacting, whether something is really, someone said something really interesting and you want to write that down. You want to make sure you take time to reflect on your field notes, and also certain things you might want to include are themes, issues to follow up, useful sources, for example. We then move on to the transcription and translation. So you might want to get your tapes transcribed. Just the take-home message here is this is a lot of work. It takes a long time. It's like you're developing a written script of the interview. I'm sure you've all seen these before. Whether you've done them yourself or not, I mean, just to keep in mind, it can take 5 hours to do 1 hour of interview. It is a very long process. Most of us now hire companies or people to do this for us, which is great. So this can be happening while you're collecting the data. You can get, record your interviews, send them away, have them come back, reflect on them while you're in the process of collecting data. Also, you may translate, you need some of your transcripts translated. If you're collecting data in a different language, you may analyze them in that language, but you might want to get them translated into English, for example. And this does take a lot of time, and it's very important to ensure quality through back translation. And it's the same as when you're sending your transcripts away for someone else or a company to do them. You need to listen to them. Listen to the tapes, look at the transcripts to make sure that the quality is appropriate before you go right into coding and analyzing them. And the same with the back translation. You're listening to them to make sure that they were translated correctly. So the next part is familiarization with the data, and this is happening while you're collecting data, after you've transcribed your interviews. You want to review the field notes, you want to listen to the tapes, read the transcripts, because this is a really important stage, because while you're doing this, you'll be taking notes, writing down some of the key themes that are emerging, really starting to build a framework or a coding frame that you can use to apply to your data. One point here to remember is that qualitative research really produces a lot of data, and often it's overwhelming. It is a lot of work. One interview can be up to 30 pages of data. If you do 30 interviews, times that, it's just a lot of data. So after we finish the familiarization, we want to organize the data. We have all of this data. It's kind of overwhelming. It's a bit chaotic. We need to make sense of it somehow, so we need to organize it. So different strategies for that is thinking about first giving each transcript a number or a code, identifying field notes by date, context, or interviewee, and then you may want to organize your data according to unit of analysis. This may be according to who or what is studied or the level of analysis. So the unit, you might think of, if you've done focus groups and interviews, you might group them accordingly. You might have done interviews with people at different levels in the health system, so you might start to group that. You put hospital managers in one group, service doctors and nurses in another group, maybe patients in another group. So you're starting to organize your data. And then just keep in mind that having multiple units of analysis within a study design can make the analysis more complex. I mean, it can also help with the validity and reliability of qualitative data through triangulation. When you have multiple sources of data and you're interviewing different people using different methods, we can cross-check across those different methods or individuals, to see if similar things are emerging, and that really helps to ensure that our data and our findings are valid. So, but it can make things more complex. So it's important to consider how these are organized, grouped, and numbered right from the very beginning. Don't wait until you have everything. Start thinking about how you're going to organize that right away. Also, one thing to start from the beginning, especially when you're transcribing, is to thinking about anonymizing your data right away. This is a real, have to do with ethics and ethical review. It's something we should all be doing. Should be done right at the very beginning while data is being recorded and shared. You can assign pseudonyms or code numbers to interviewees and create a secure file that links pseudonyms or code numbers to informants, and you keep this in a secure location separately from your data. And you want to make sure you remove names and other identifiable material from transcripts. For example, if you're interviewing, a hospital managers and there's only one, you have to make sure you remove the name of the hospital because it'd be really easy to identify that person if someone were to come across your transcripts. So you need to think about this from the very beginning. You can also think about numbering narrative data by line or paragraph numbers, and software packages may do this for you. And just remember to make copies and backups of your files. So one of the worst things is to do all this work and then lose everything. If it's only on one laptop and that laptop is stolen, you've lost everything. So just make sure you make copies and backups. So now, developing a coding frame. This is part of the, we're still kind of in the organizational stage, you know, organizing our data, trying to start, we're not yet in the interpretive stage. So coding, sometimes called indexing, really helps us to organize what's in the data. So we've already organized our data by respondents, by overall unit of analysis, by method. Now we're going and organizing what's actually in that data. So this begins during the literature review and familiarization of the data, as I said previous. So you start to develop a framework or a list of codes that you can apply to your data. So the codes can be based on topics, ideas or concepts, key phrases or words, analytical ideas, a type of action, type of event, or an implied meaning or sentiment. Really anything and everything. So what you do is you make notes on the transcript on topics, ideas, concepts, etc. These are what's called the codes. And if you're working in a team, you need to make sure you agree on these codes. One way to do this is to take the same interview, give it to 2 people on your team that will be coding your data, to have them free code or open code to just write in the margins what they think is what is emerging in that data, and then they come back together and they discuss what each of them found to see if there are similarities and differences. So this helps to start to agree on codes and to jointly develop a coding frame. So once you've listed the codes that you've identified, this is your coding frame. So before I move on to the next slide, just to a point of when we're developing our coding frame, what you'll do is, as I mentioned before, you might take 3 or 4 transcripts, open code them, which is starting to assign codes, and then you use those to develop a coding frame that you apply to the rest of the data. And then if new things emerge, you go back to the original or the first ones that you looked at to see if those codes are in there as well. So like I said, it's a very iterative process, back and forth. So there are 2 types of codes when developing a coding frame. There's a priori codes. These are the deductive codes. So they emerge from your previous knowledge, research, or theory. They're framed by research questions or interview questions. And then there's grounded codes. These emerge from the data, and you need to put aside your previous knowledge. You just want to see what's coming out of the data. And you'll use a combination of both. There are 2 kind of approaches to coding. One is called open coding. I've already used this word. This aims to discover, name, and categorize phenomena and develop categories in terms of the properties or dimensions. So this is when you just look at a transcript and you just look to see what's in there. Really, and then Accel coding, this is a later stage. This is more of an interpretive stage. After you've done your initial open coding and have coded your data, it's making connections between your pre-existing categories and order their analysis using core headings. So you can develop a coding tree, higher, lower level codes. As I mentioned, these could occur later in the analysis. After you might start to see themes between the codes that you've already made, and then you'd make a new code to explain that relationship. That's Accel coding, so it's a later stage coding. So this is an example of a coding frame. There are many different examples that we could use. This is one that I've developed recently using a specific framework. I did a gender analysis of maternal health care access in Uganda. And we had 3 kind of overarching themes that were This was all basically pre-existing a priori codes. So we had birth preparedness as one theme, transport and quality of care. And then under each one, I looked at different topics, the resources, who has what in relation to birth preparedness, who does what in the home, what are different norms and values, and what does the decision making look for. And I used that other issues category for my grounded codes to see what emerged from the data. I mean, you might have a more, there's so many different ways to structure a coding frame. And just a really simple example I like to use is you might be thinking about emotions, for example, and emotions might be your overarching theme, and then each sub-theme is a different type of emotion, happy, sad, angry, right? So you've got your master code emotion and your sub-codes, the different emotions under that. So now you rearrange the data by code. So this coding, or sometimes indexing as used, means assigning these themes to passages of text based on your coding frame. So you've developed this frame based on pre-existing work, data, literature, looking at 3 or 4, 5 of your interviews to see what's coming out. And now you have this frame and you're going to apply it to the rest of your data. So in the past, again, you maybe use colored pens, scissors, glue, Post-it notes. Now we tend to use more qualitative software, and I know that the next webinar that Lygia is going to be doing was really going to be looking at this. How do we manage and organize our data? So it's at this stage is there's an ongoing reappraisal and revision of the themes, recoding. So you might select themes that require further investigation. It's important to note that any new codes identified after the development of the coding frame will need to be applied to the whole data. So, or, I mean, you can do, if you come up, there's a theme that emerges that you think is really important, but you've already looked at 10 interviews, it is very standard practice to go back and look at those 10 interviews again, specifically for that one code. You may have that other category and group it into there. It's really up to you. And if you're working in a team, jointly review 2 to 3 transcripts to check and discuss how codes are being applied. So this is after you've developed your coding frame. You've got multiple people coding your data. I would always recommend looking at 2 to 3 transcripts jointly, like individually first, the same transcripts, seeing how you each applied that coding frame and seeing if there are any differences and similarities and explaining those. So here's an example of just noting themes on transcripts. Often computer software will do this for you, although that project I just worked on, the gender analysis of maternal health care, I actually did by hand because there weren't too many. It was focus group discussions and there weren't that many. So it was something that I could do by hand really easily. If you have a very large data set, computer programs make things a lot easier. So it's just marking and highlighting different themes. And then the one thing I wanted to point out here is that there's some kind of double coding going on. And this is good. I mean, you don't want to, you might triple code something, but you don't want to go away, let it get out of hand and assign 4, 5, 6 codes to one passage. You want to limit it. Like, what is that passage? What is the general gist of it saying? And double codes are useful because it helps us to get to that analytical interpretive stage to start to see relationships. If you've assigned 2 codes to one passage, there's likely a relationship between those codes. And if that's reoccurring over and over, that might be something that's really important in your data. So it's important to take note of these double coding that might go on. So the next stage is the interpretation. So we've just organized our data, organizing in terms of, into units of analysis, in terms of coding, and that the organization part is really the brunt of it. That is 80% of qualitative data analysis is organization and management, and the rest, the 20%, is the interpretive part. We can't really effectively interpret our data unless we've organized it adequately. So the interpretation stage is really where you start to identify themes and relationships, patterns and links within the data among the codes and categories. You keep notes as you explore relationships between the codes. Certain things you might want to look out for are similarities between themes and respondents, contrast between themes and respondents, and different explanations. Develop concepts and arrive at some generalized statements and a conclusion. If a category is absent, this is also significant. If if one person said something but no one else, why is that? If there's something you know is really important but no one's talking about it, why is that? Research participants may be involved in this process. I mean, this is usually with participatory research. And just remember, it is an iterative process. You're constantly going back and forth. You're looking and seeing, oh, this looks like a pattern or potential relationship, going back to the data, making sure that you have evidence to help explain that relationship and those patterns. So this is the analytical hierarchy. It sort of helps us, we often will move from the bottom to the top, and it helps us to see the different stages in the overall analysis. So you start with your data collection at the bottom, the primary raw data. You've got all of this data. We now need to kind of manage it somehow, and then that's the data management part, identifying initial concepts and themes, tagging the data, coding, sorting the data, grouping them together, and we're starting to maybe summarize or synthesize data. The next part is descriptive analysis, trying to describe what's in that data. You might identify elements and the dimensions, establishing typologies. And the next part is explanatory analysis. We start thinking about detecting patterns of association, developing explanations, seeking wider applications. I see that, so just the points at the bottom here, we got the descriptive analysis is really concerned with describing and mapping the data, whereas explanatory analysis is concerned with understanding how and why. I see that Adam has a question here, so go ahead, Adam.
Hi, thanks. My question is that what I struggle with at this point is I think that the results of a study is obviously different to kind of the more interpretive discussion aspects of a study. And to me, it's finding that in this analytical hierarchy where the so-called results section lie and where this kind of wider applications, discussion section lies, and going through that, moving in a going to higher levels of abstraction, and I find that very difficult. Have you got any tips when we do that?
Thanks for the great question. No, if I were to map this out on, say you're writing a journal article and I was to map this out, right, the descriptive analysis stage would be my results section. I'm explaining what is in the data. This might be mentioned before, looking at typologies and classifications. For example, in the work, I just finished writing a paper on the gender analysis of maternal access to maternal health. You might look at what are all the various barriers to access, and then that can develop a typology, and that's my results section. But that's descriptive. That's explaining what's in my data. How do I then go and explain why those barriers exist, right? That's the interpretive stage. And I'm looking at, and I'm hoping when we go and talk a bit about the framework as an approach, it might help a little bit. It's when I'm looking for patterns, seeing how do some of my themes relate to each other. So if that's a barrier, this person has mentioned that a certain topic like lack of money is the access barrier. They don't have money to pay for healthcare. Why don't they have money? This was a gender analysis. If it was a woman and she's a pregnant woman, it's because she maybe doesn't have control of her financial resources. She doesn't have ability to make decisions about where those resources go, and that I'm looking for those wider explanations in my data, looking for cross-coding, double coding. It helps to explain why that barrier exists. So that's really looking for patterns, looking for relationships. You can also use pre-existing data, like you can use other studies to help try to explain. You know, in our discussion section, we often we'll explain our data and then we'll relate it to other studies. We can use those other studies to help build a wider picture and help explain. I hope that answers your question a bit, and hopefully when we get into the framework as approach, it'll help a little bit more as well. So I find that this hierarchy just really kind of helps me to think about the different layers. Often we get stuck at the descriptive analysis stage. It's hard, that I mentioned before, where I struggle is moving up to that explanatory stage. How do I explain my data? How do I interpret it? How do I make sense of that data? Right, that's where I struggle with. But again, it's just looking for patterns. It's sort of the black box of qualitative analysis. That's how I describe it. It's really hard to explain this part. And that's why I like framework analysis, because it helped me to give different steps to start to make those connections. So I'm moving on now. So there are some key decisions that you need to make. Oh, sorry, before I move on, Adam, did you have something else that you wanted to say? Please go ahead. I think he might be having some connection issues you mentioned, and but feel free to, if you want to jump in again. I'm just going to lower your hand. Feel free to raise your virtual hand again if you want to jump in to ask something. So there are some key decisions you need to make in qualitative data, which will help with this explanatory stage. So to arrive at conclusions, you need to interpret the data and make significant decisions that will help shape your final outcome. For example, this can include prioritizing certain parts of the data, which parts are more important than others, reducing the number of codes, categories, and themes, merging codes and categories, groups together, looking for shared features. This will help to start to develop a larger picture. When you start to think, oh, this is quite similar to this, what does this mean? You create a new code. That's that axle coding I was talking about before. You might develop a hierarchy of codes and categories and themes, differentiate between higher and lower level codes. Those higher level codes will be broader and more inclusive. You moving towards key concepts. You're using these higher level codes for the identification of key concepts that are related to the data. So what is in the data? What is the data saying? And then you might compare the new generalized conclusions with alternative theories or explanations. Consider competing theories. Are there places in the data that contradict your conclusions? That, you know, if you come up with this interpretation, is there something that might counteract that, and why that is? There's nothing wrong with that. We just need to make sure we show the whole picture. So the next stage is kind of the last stage, is the reporting of findings representing the data. It's when we actually write up our data. Writing is part of the analysis process. Don't expect to have all the answers before you begin writing. You can use the writing to help you look for and develop explanations. Writing really helps me because I try to put my thoughts down on paper to help explain what's in the data, and I realize that those explanations just aren't working. So I go back and I look for other things to include. It helps to see what works and what doesn't work, whether or not data supports your interpretation. If you wait to have all the answers, you may never start writing. And it's very important, and this is in the results section as opposed to the discussion section, you have to use quotations to support your interpretations and evidence and your findings. You need evidence. We mentioned before at the beginning that the key principle is that our interpretations are firmly rooted in the data. Having quotations will help with that. Just a point about reflexivity, we mentioned this before, it's just very important. Again, it's an awareness of the researcher's contribution to the construction of meanings throughout the research process, and an acknowledgement of the impossibility of remaining outside of one's subject matter while conducting research. It's a very big part of qualitative research. reflexivity to think about how, again, how our own worldview and perceptions impact how we're interpreting the data. Just a quick note about using computers in qualitative data analysis, and I think Lygia will talk about this more in the next webinar. They can aid us in the process, they can help organize and manage our data, but they cannot do the analysis for you. It's up to you to identify themes, code, and interpret and analyze the data. They're not they can really, especially if we have large data sets, they can really help, but they're not the end, you know, they won't do the analysis for you. They won't help you. They'll help you get to that descriptive stage, but and there are some tools and functions to help interrogate your data, but they won't do the analysis for you. I have a question and comment section here, but just in the nature of time, I'm going to move on to the next section just on framework analysis to make sure we have enough time, and there'll be some time at the end for overall questions. So we'll move on to framework approach now. So framework approach, as I mentioned before, is just one approach to qualitative data analysis. It's a thematic type approach. It was developed in the context of applied policy research and usually used for policy and practice related research. And it was developed by Ritchie and Spencer, and there's a slide at the end here that will list some resources that if you want to read more about it that you can use. It's a matrix-based method for ordering and synthesizing your data. It's really a type of content thematic analysis. So, I mean, there are many different approaches that you can use. You don't have to use framework approach. I like it because it has distinct stages, and it helps me to move from that kind of descriptive stage to the analytical stage. So as I mentioned, it has distinct stages. It has this overall balance between induction and deduction. You can use a priori and emergent codes. It is heavily more on the a priori codes, and we'll go to that in a moment. It's a case and theme-based approach. I won't go too much into what this means, but it means that your cases are either your individual respondents, so each interview that you did with someone could be one case, whereas the overarching themes are your codes, right? So it uses both approaches and at the same time to cross-look at your data, and you'll see more when what that means when we look at the charting phase. So it groups data using substantive themes and subthemes. So those are those higher level and lower level codes. It reduces data through synthesis of transcripts. This helped me to manage the data, and also retains links to the original data. So it has some key stages, and you'll see that this really maps on to the overall stages of qualitative data analysis. You've got your familiarization stage, you know, when you're reading the proposal, transcripts, topic guides, field notes. You've got the stage where you develop a coding framework, looking for key themes and sub-themes. You've got the indexing stage, which is that coding, where you're applying codes to the whole of the data. The charting stage, it's a summary of data by case charted under themes. This is really where framework approach differs from other approaches, is in this charting stage. You don't seem to normally see this in other approaches. Then you've got the investigation and interpretation stage and the reporting of findings. And this helps. What I like about framework is that it provides a paper trail to your analysis, and you'll see why. You're producing like codes and you're producing charts. So if you are challenged to show how you did the analysis in the future, you can go back and show them the different stages that you went through and how that helped you arrive at your interpretations. So it does help. I mean, with all qualitative data analysis, part of ensuring that our findings are valid, reliable, is making sure they're firmly rooted in the evidence. But to do that, we have to have a paper trail. We have to have evidence of the process, and this helps with that. So I'm not going to go into too much detail about some of these stages because we already talked about them. I'm just going to talk about the key differences, like how does this stage of framework differ from the overarching stage we just talked about. So we already talked about developing a coding frame or framework. I showed you my example of the gender analysis and maternal health access. The key difference with framework and approach, and I think it's because it emerges out of policy analysis. It was meant to be a quicker form of analysis, whether that's debatable, whether or not it is, but it really advocates for only having 5 to 6 master themes or higher level themes, each with 6 to 7 sub-themes only. And that's important because once you developed your coding frame, you stick to your coding frame. It doesn't change. You always have an other category to put emerging findings. And if something really important emerges, you might add it to the frame, but the coding frame. But the key difference is once you've developed this and you develop it at the beginning, you can do so by looking at a few initial interviews and focus groups, looking at existing data, it's a priori themes. Once you have it, you stick to it. And it can change a bit, but you have to go back and apply any new codes to the entire data set. So the next stage is charting, and again, I said this is where this approach really differs from other approaches. This is the part, this is what I like, this is why I'm an advocate for it. So charting happens after codes have been applied to the data, and it can be ongoing at the end. You can do, you'll see why. I mean, you can do the charting as you're going, because you can, what it is you're applying summaries of the data in a table, and you can do that as you go along, or you can do it at the end. So it's summaries of data by case charted under themes. You don't just cut and paste the raw data, you actually make a summary of it, and I'll have an example in just a moment of what that looks like. You use tables to showcase the data. The rows are respondents, units of analysis, and columns are the themes. So each column is a theme and each row is a respondent, and then as you can imagine at the end, you can look at one theme across all respondents in one table. You can use Word, Excel, or framework software to do that. What's really important at this stage is to maintain a link to the original data. You have to note the page references, create links between the summaries and the original transcript. This will help you to find the original source. You can avoid repetition by cross-referencing data within a table. See table such and such on page 3, for example. You can use an other column for interpretive notes, overarching issues, important issues, emerging themes not in the original coding frame. So here's an example. It's just obviously the table was much larger than this. It's the same example of that work I did on the gender analysis of maternal health care access. This was a focus group discussions. So each row is each focus group discussion itself was a unit of analysis. We didn't divide the individuals. So if I was doing interviews, each row would be one person. So as you see, we had household support. This was one main theme. And then we had resources, division of labor, social norms, rules and decision making. What I did is after I coded in under one focus group discussion, I summarized what that one particular code said under resources, and you can see the numbering are helping me to find that original code or original text. So once I've finished with this table, I can look under the division of labor column, for example, and see what all of my respondents said about that, and start to look for patterns, look for themes, look for categories, maybe create a typology, look at all the different ways or how people explain the division of labor, and then start to see whether there's any cross-references with any of my other themes. So this helps to the next stage, which is the investigation and interpretation. You start to identify themes and relationships, patterns and links within the data. You do that by looking across each column or across each row. You can see what one person or one focus group said about all those different themes. You could start to, like I said, you group summarize text together into overarching themes or relationships, and you can start to create new tables with condensed summaries, and I have an example of that on the next slide. So we have our original table, and I'm starting to group together what everyone said about under division of labor, and I'm starting to create new themes within that, new categories, and I've create a condensed table. So again, make sure, very important, to retain page references, and you can start to prioritize which themes and relationships are the most important, those which help you understand your research aims, objectives, or questions, and these are maybe the ones that you write up, that you include as your main findings. We can't write up everything, we have too much, but so you need to prioritize what is the most important, what helps to explain my data the most. Here's an example of that summarized table. So I had my original one, which had all of the summaries, no particular order, just in the order in which they were in my transcripts. So we looked across the columns and started to group what people were saying and making more kind of Excel coding in a way. So you can see I've got themes within my theme here under division of labor. Who are the people that helped with the division of labor? 1, neighbors came and assisted. 2, husbands took the woman to health facilities. 3, husbands didn't take women. So I can start to see what all of the division of labor. I mean, this is just a tiny portion of this table, so obviously it was much larger. But it really starts to give me a picture of what's in the data. This is still quite descriptive, mind you. I mean, it's looking at across all the themes, but now I can start to see if there's any cross-references, start to think about relationships, think about where things were double-coded, and this will merge as you're doing this. So then, I mean, the next stage is obviously writing up your data, and I didn't include a slide here because it would be the exact same as the other one about, you know, you start to write your description results section, and then your discussion section are your more wider explanations. And again, not to wait until the very end, because the writing process can help you through some of that analysis. So here are some key resources that you can use. Some examples of people who've used framework. The 2 Ritchie articles, or they're both books and book chapters, are very specific to how to use and apply framework analysis. So just moving to the conclusion, and then we can move on to the question and answer session. Just some key overarching conclusions and tips then. Remember that analysis starts during data collection. Don't wait until you've collected all your data. Start to record what some of the emerging themes and key issues are. This will really help you in developing your coding frame. Remember, data management is very important for the overall analysis process. I said before, it's about 80% of what you do. It can be quite boring, it can be quite dull, but it's very important. The better our data is managed, the more we can help with the interpretation. And if just going back to the framework approach, you know, the coding and the charting, all of that is management. I'm starting to reduce my data to help to make sense of the data, and it really allows me to go in and interrogate and investigate that data, look for themes and relationships, right? And then when you start to develop themes and relationships, I can go back to those charts and see if it will help there's evidence to explain my my interpretations. Remember, it's an iterative process. It's back and forth, up and down. You're constantly going back to the raw data, looking at your final results or your final interpretations. It is guided by assumptions, theories, and hunches, and which we validate through descriptive and explanatory analysis, use of quotes. So often these assumptions, theories, and hunches will emerge during data collection. They can come at any time. They're sort of light bulb moments that occur when you're looking at your data. You're just trying to make sense of it, and all of a sudden something will click, and then you can go back and look at your data to help explain what, you know, those assumptions and theories. Remember, writing is part of the analysis process. Don't expect to have all the answers before you begin. You use the writing to help you look for and develop explanations. You can use computer programs to help you, but remember, they're mainly for organization and management. They help you to manage and organize your data. They won't do the analysis for you. And the last point here really is that qualitative research is not the easy option. Analysis should be trained and experienced in qualitative analysis, and because it can take a lot of time. You have a lot of very chaotic piles and piles of data that you need to make sense of, and the youth framework helped me because it helped me to use those distinct stages to sort and manage and start to make sense of my data. But it can't be done quickly. It's a really, I mean, I remember when I was doing my PhD, it took me, I did months and months to analyze my data. It really depends on the size of the data set, the length of your coding frame, your overarching aims and objectives, but just remember it's not the easy option. So we've got about 5-10 minutes for questions here. So I'd like to end, see if anyone has any specific questions or points, comments about anything that we've raised today during the webinar. I've got some key points for discussion. For example, how you change your approach to qualitative data analysis based on today's discussion, or what is something that is important to consider in relation to qualitative data analysis that was not discussed today. Alternatively, is there something that you think is really important that we should emphasize that was discussed today? So feel free to raise your virtual hand. So I see Renee has a question. So Renee, please go ahead. No, Renee? We'll move on to Linda and we'll go back to Renee in just a minute. Go ahead, Linda.
Can you?
Oh, Renee, yes, we can hear you. Please go ahead, Renee.
Oh, sorry, I didn't realize I was muted. No, thank you. I don't actually have a question at this stage. I just wanted to say that unfortunately I have to leave. But before I do, I want to just thank you for this great presentation. And you did it really well, and it was very clear, and it's very exciting. And I particularly like the framework approach that you presented. So I'm looking forward to reading around it, and I will ask the rest of the team to just feedback to me on the rest of your discussion. So thank you so much.
Great, thank you very much, Renee. And I'll be sure to forward the slides today to everybody, so you'll have access to all the resources. So, Linda, over to you.
Hi, Rosemary. Thanks for the great presentation. It was just a really nice overview of just a very sort of useful approach. I think it's not, I've read about the framework approach but haven't really applied it. So I think, you know, in some positivist realm, you try to almost sort of shy away from the charts and the, you know, you kind of feel you're not being authentic in a way, but you know, I think this is something that I think I would definitely apply and take on. So my question is actually relating to the coding and the code. I think you called it the coding frame. So we've developed a code book for our sort of data analysis, and we use sort of a priori codes that we develop based on our reading and based on the conceptual framework that we developed. And just to sort of highlight, the conceptual framework that we're using is an adaptation. It's basically the health policy analysis triangle, and we've superimposed aspects of a framework looking at contracting in, basically. So my question is relates to, you know, how, if one has, obviously you may use both sort of a priori and an emergent, you probably will. So how does one, you know, approach the analyses given the fact that, you know, but still being open to sort of developing, to being open to any sort of emergent codes? Do you just go in with your a priori codes and apply them? Because, you know, as a team we've looked at these and we've agreed on them, but obviously we want to also be open to and allow the data to sort of speak to us, if that makes any sense.
Oh, yes, thank you for that really good, interesting question. Yeah, that makes a lot of sense. And I think with something I used actually the policy analysis triangle as a framework in my own PhD. Actually my PhD is quite similar to what you all are studying. I looked at policymaking in faith-based organizations in Tanzania, and you develop this coding frame, as Linda talked about, based on maybe a framework, and that the coding frame I showed you on the gender analysis, that was based on a pre-existing framework as well that looked at, so in terms of gender analysis, what are the key areas that you want to look for, and then we use that as our coding frame. So I should have highlighted that kind of more that you can use an existing frame, and the policy analysis triangle is a really great example about that to help you develop a coding frame. You want to, and then you apply that to the data, but as Linda said, you want to make sure that you try to remain open to having emergent codes. And what I would suggest is always having an other category in your coding framework, or in the one I just did, I had a category called cross-cutting issues. So that worked well. So it might not have applied. Issues that didn't apply to my pre-existing codes and coding frame, I put them in this other category. And at the end, you might go through that and decide, look through all those codes. Maybe you've used a computer software so you can see all of them at once, everything you've put into this other, and you can try to make sense of what's in there. And if there's anything really important and emerging, and then you label it with a theme, what you need to do is almost pretty much go back, which it doesn't sound very fun and exciting, but go back to your transcripts and look for that particular code if you think it's very important. And also stuff in that other category might help to explain your existing. So just always make sure that you leave it an open category for emergent themes that come up. And if you're using framework, there's always an other column in my chart so when I am for example, I'll have maybe my row is a person. I've summarized what they said based on all my themes. And now if there's something else other that relates to that overarching theme, I plug it into that column. Or I might create a whole new table specifically about other categories. Linda, hopefully that answered your question. I see your hand is up. So did you have something else you wanted to share?
I think I just pressed it twice by mistake. No, thanks. That was very helpful.
Okay. Yeah, thanks. Great. Does anyone else have any other questions or comments before we wrap up? Yeah, Lygia?
Hi, Rosemary. Thank you so much for the excellent presentation. I didn't have a question or a comment per se on this, but if there are no other comments or questions, I just wanted to remind everybody of the next webinar, which is currently just in the date planning sessions, but the topic is qualitative data management. And Rosemary introduced some of the topics that we'll be going into greater detail about in that webinar. Many of you have already responded, but if you or the other members of your team have not, please see the doodle poll that I sent out yesterday and share your availability by in the next few days. Hopefully by next Wednesday we'll be able to hear enough from enough people to set the final date. So that's all I wanted to share.
Great, thank you. Krishna, did you have something you wanted to share?
Hi, Rosemary. No, I just wanted to thank you for this really interesting presentation. I certainly learned a few new things, and I'm hoping everyone else did too. So yeah, just so thank you.
Great, thanks, Krishna. And probably do need to wrap up now. It is, and we've been here for about an hour and a half. The one thing I kind of just want to stress is how I really learned about qualitative data collection and analysis was just really going and looking at resources and reading. So if there's anything here that you want more detail about, you know, feel free to get in touch and I can direct you to some resources. Or as you'll see, I've included a list of resources at the end of the webinar on different topics that you might find interesting. If you're particularly interested in the framework approach, do read the two Ritchie resources, and they're both freely available online. That will really help. It goes into greater detail with providing examples of all the different stages that you can use. And I guess with that, just like to thank everyone for joining us today and wish you the best of luck in your research, future research activities and your data analysis. And at any point, if you have questions about anything or you want to run something by me, feel free to get in touch over email. I'm happy to schedule a Skype call or just discuss it over email. So thanks everyone, and with that I'll go ahead and end the webinar.